So getting help in neighbourhoods is a really important part of our mental health transformation across Leicester, Leicestershire and Rutland. It's about creating stronger, more resilient communities. We teamed up with the Leicestershire and Rutland Community Foundation to create a local fund that would enable voluntary sector organisations to deliver more activity in local areas. Round one was really successful in seeing 26 organisations applying and receiving funding towards their activity of around about £800,000 of spend. The important part is making sure that those organisations are really connected in with the local health, social care and other local partners in those neighbourhoods. And we brought them together in our first event to be able to meet each other, talk about the challenges that they're facing and get to know each other better so that then they can work with each other across the year to provide even more support together to people with mental health challenges. And we're going to hear from a few of those organisations in this video.
I was really pleased to be actually invited to chair the first panel for the Getting Help in the Neighbourhoods for the Mental Health Fund. I think it's vitally important that we try and help people who are suffering from mental health illness as early as possible. And the funds have been going to some very good voluntary organisations, both in city and county, that will actually make a big difference to isolation, getting people out, meeting people, socialising. But also we need to be looking at the housing issues, career losses, etc., that really impact people. The success will be, the networking that's going on to bring people together through the integrated care system that's being put in place. It's bringing NHS, LPT, CCG, voluntary organisations and local government together to try and make a more seamless provision for people who need it. And I think that voluntary organisations are absolutely key to assisting us with that. We've got some very committed and dedicated people running these organisations and we have to support them as much as we can.
The Community Foundation is a grant-giving charity, but we don't just have the money. We spend a lot of time working with individuals, families, companies to get them to give grants locally. So rather than always choose a national charity, we're really keen to get them to invest locally with the local voluntary sector. But we also work for government and for public sector organisations, and we are the ones that got the grants out for the Getting Help in Neighbourhoods fund scheme, grant scheme. And we know that they do a vast amount to help communities and mental health and well-being already. So the fact that the NHS CCG have also acknowledged that and are working with what they do, we think is just amazing and innovative, and we're really excited to be involved. We think it's just great. And some really good decisions were made around some really, really good groups that are doing incredible work with their communities.
So Falcon Support Services provides supported accommodation and community projects across Leicestershire, so working with those that are homeless or vulnerable in the community. 76% of our service users that are homeless face mental health difficulties, and being able to have workers specifically supporting them around their mental health is really vital. We have one-to-one support sessions and group sessions that they will be delivering, and we'll also be training our staff within the accommodation to raise awareness of homelessness and the issues they face. It's really for our service users to be able to live more independently, to better manage their mental health, to feel happier, to not feel as isolated, be taking part in positive activities and just be living more fulfilling lives.
Our organisation set up in 2017 and we were a community group that set up a community hub for the community that's run by the residents. And what we do is we provide a space for the whole community to come with any issues they've got. And we set a lot of projects, so we've got projects from birth all the way up to the elderly. We're self-funded, so we don't get a lot of funding. So a lot of ours is a lot of voluntary work, additional hours, puts a lot of pressure on the people that are volunteering there and also working. What this funding's been able to do is to give us that additional support that we can keep running the services we can add to the services that we're doing and open our hours up more. So we're now open from 7 o'clock in the morning till 10 o'clock in the evening. What we can see already, the difference we're making with just being open, doing smaller projects and open up just a small amount of time, the difference that we're already making to the community. So being open that bit more and that bit longer, it just means that we're able to reach out to those that couldn't get there in the daytime sessions. We've now got evening sessions. So it's just being able to see what we can help and how we can help. Our main aim is to listen to the community's voice, because we have a community that's quite non-engaging. So they'll come into the hub and because it's very chilled, it's like home from home, they're able to talk more about what the issues are, and then we're able to bring people in and signpost people out too.
Ad Hoc Project provides advocacy support. We run groups. We also provide counselling services, which is CBT, and DBT, which is cognitive behavioural therapy and dialectical behavioural therapy. Our services have been predominantly for the city-based clients, but through the pandemic, we realised that we had a lot more clients coming through from the county. And having a look at it demographically, there wasn't enough service provision that provided the BAME community some support. So ideally with this funding, what we'd like to do is get ourselves out in the county area and start providing support for the clients in the county area. By the end of the project, ideally, we'd like to have the setup in county and a lot more clientele from the county accessing the service. To be an accessible service within county that provides cultural competence is very important, and I think by having that process it will allow the community to engage further with the service.
So Sharon Women's Centre has been around for over 35 years. We work with vulnerable women, specifically women from ethnic minority communities. It would really be beneficial in us supporting us to continue to support services like our B2A Bereavement Plus project and our Corona Comrade service, which is a befriending service. The grant would certainly allow us to build better connection with other agencies and cascade best practices, what works, what isn't working, and how to improve services and support one another, and as well as signposting as well.
I run the Thrive project, and the majority of the Thrive project consists of singing cafes. We also run tea parties, but the reason I'm here today is about our singing cafes, because that's what the money was given for. And we run at the moment 6 of them across Leicestershire. And what they do is they gather people from all walks of life, all types of mental health problems, from people who may be feeling a bit down to people who are in the last stages of dementia, because it's open to everybody. And because singing and dancing, if you're able, is very good for your health. If your brain is active, you're much more likely to experience better physical health. So this grant is going to make an enormous difference to us, because one, we can carry on doing that and reaching as many people as possible, and we can also consider planting more cafes and reaching even more people.